So good afternoon, everybody. This is Connie Burke from the Office of Addiction Services and Support. Welcome to our quarterly community meeting to talk about the opioid settlement funds. I'd like to take a moment to pass to my colleague at OASAS, and then we'll go to DOH. I see Debbie Davis has joined us.
Hello, everyone. Good afternoon. I'm Deborah Davis. I'm the Associate Commissioner for the Division of Fiscal Administration here at OASAS.
And Val.
Hi, everybody. I'm Valerie White. I'm a Deputy Director at the AIDS Institute. Nice to be here.
Terrific. Thanks, everybody, for joining. Others that jump in and join. We might hear some additional beats, but like to get started, and I'm going to go ahead and share my screen and jump right in. So just a couple of housekeeping items for those who are new to the community meeting. We typically record the meeting. You heard that already. And we do encourage you to add questions and comments using the chat function. There will be a question and answer period towards the end of the hour, and you can certainly also raise your hand and we will unmute and give folks opportunity to ask questions that way as well. In terms of the purpose and the frequency, I was reminded by staff that we've been doing this for a while, and we will continue doing these meetings for a while to come, right? OSF is going to be part of our lives for a number of years. And so in terms of the meetings, the reason why we are holding quarterly meetings, we at OASAS, as we lead and manage the use of the opioid settlement funds, wanted to provide an opportunity in collaboration with DOH and OMH to talk about the use of the opioid settlement funds. We wanted the community to have an opportunity to hear about the work that we're doing, and then also if there were questions or comments, that this was a forum in which folks could do that. So again, we have meetings on a quarterly basis at this point. We do record and post all of the meetings to the OASAS webpage. So if you have not had opportunity to attend before and you're interested, you can go back to the archives and listen to the meeting. And I appreciate that you're joining today. We already talked about our partners, DOH and OMH. Chris Smith from OMH typically joins us, and he's unable to join us today. So we will miss him. Opioid settlement fund refresh. Again, kind of why are we here, and you know what's the reason we're gathered. So the state is in receipt of and will continue to receive dollars that are part of the opioid settlement funds. There are a number of different settlements that are bringing dollars to bear for the state to use to address the overdose crisis. And as I said, OASAS acts as the lead in managing those dollars. We do work in partnership with both DOH and OMH on the use of those dollars. And we also work with and take recommendations from the Opioid Settlement Fund Advisory Board that we'll talk about in just a minute. Today we're going to do a quick kind of what's new, what's now, what's next in this presentation, and then certainly interested and looking forward to hearing from DOH with regard to their work utilizing the Opioid Settlement Fund. So while New York State is a recipient, this is a national, a nationwide settlement and opportunity for all states to utilize dollars to address the overdose epidemic. As I had mentioned, the Opioid Settlement Fund Advisory Board does advise and provide input to OASAS and the state with regard to the use of these dollars. And as I've already said a number of times, OMH and DOH work in conjunction with OASAS on the use of the dollars. In terms of the board is made up of appointed members from across the state. The three commissioners from the three state agencies, OASAS, OMH, and DOH, also sit on the board. And as I've mentioned, the purpose of the board is really to develop recommendations and offer those to the state with regard to how do we utilize this funding opportunity and how do we address this crisis. The board meets on a regular basis, and part of the discussion and part of the purpose and the work of the board is to issue an annual report that includes recommendations. And so for awareness, that report typically is due on November 1st and offers an opportunity for the public to read and understand recommendations in the use of those dollars. Information about the board is also available on the OASAS webpage, I should mention. And there you can find the meeting schedule, recordings of previous meetings, as well as that report that I just mentioned. So the annual report, which comes out November 1st, is also available on the webpage. So I encourage folks to utilize that and address that link at the bottom of the screen, which will take you right to the OSFAB, as we refer to it, the OSFAB section of our webpage. One other thing I wanted to make mention of with regard to those meetings is that there is opportunity for public input. So at every OSFAB meeting, the public is invited to attend and give comment. You do not need to sign up in advance. You can actually go to any of the locations where the meeting is occurring, and I say any of the locations because we do have satellite locations outside of Albany. We also make available space in New York City and then also in Buffalo, so that folks do not have to travel to Albany to participate. You can go to any of those locations and provide public comment at the appropriate time. Also, for awareness, there was an OSFAB meeting last week. We do have another one coming up next Tuesday. So a week from yesterday will be the next OSFAB meeting. Again, all information is available on our webpage. So in terms of focus areas, so kind of as a refresher, the board in their initial report had identified 10 areas where they recommended we focus our efforts, and we also determine dollar amounts to be made available and kind of content areas to focus on. So those areas are on the screen: harm reduction, transportation, services across the continuum, priority populations, treatment, recovery, prevention, housing, research, and public awareness are those 10 priority areas, those 10 focus areas. They also had recommended that we consider some overarching themes in the use of those dollars, and those 3 overarching themes include co-occurring disorders, service equity, and meaningful evaluation. And then in terms of how we make dollars available, what's the process? Know that an amount of the settlement does come to OASAS as part of our state operations budget, which we then are able to use in conjunction with DOH and OMH to fund services. So utilizing those state operations dollars, you will see RFAs posted. Actually, on the OASAS webpage, on the Opioid Settlement Fund Tracker, you'll access detailed information on every funding opportunity that we've made available. And it is a wealth of information in that you can actually link to the RFAs that we've issued, where awards have been made. You can link to press releases or lists of the awardees and who received money under each RFA. So there's a lot that you can access, a lot to be said about the work that we've done so far. There's also the regional abatement. So these are dollars that do pass through OASAS, but we make them available to downstream entities. So in this instance with regional abatement, there are dollars that are assigned by the settlement for each region of the state, as well as for the 5 large cities and other litigating entities. Again, OASAS is not making a determination on the amount available out of each year's appropriations for this purpose. This is driven by formulas and information that is listed in each of the settlement agreements. But we do make that make those dollars available each year. In terms of what's new with the work that we're doing, want to mention medication for opioid use disorder in jails is an effort that is underway utilizing the opioid settlement funds. OASAS, in partnership with counties and jails, wants to be sure that we support jails in making medication available for opioid use disorder. For awareness, starting in October 2022, all jail and correctional facilities needed to make available all 3 forms of medication to treat opioid use disorder. So OASAS is adding to the support that we are have been providing to jails by supporting access to methadone and working with our opioid treatment programs to make methadone available, to act as the provider doing guest dosing for individuals who are in need of methadone within jail facilities. We also have our Government Academic Research Institute. So that is an RFA that we had issued. It's taken some time to get through our process. We have awarded an entity, and we are excited to shortly be able to talk about that collaboration and a work plan around that partnership and how that academic institute is going to be able to inform the OSF evaluation. And then finally, I wanted to mention the Leadership Institute. We're very excited and want to be sure that folks are aware that we are working through the process to award an entity for the Leadership Institute. This partnership and this work is going to provide learning opportunities for our system beginning in 2025. Stay tuned for more on that one, but very excited about what we're able to offer to our system in terms of training and leadership opportunities, and really continuing to enhance the workforce. They're critical, right? Without the workforce, you know, we can't get this done. So happy about the work that we're doing to help support staff in the system. In terms of what's now, I had mentioned the regional abatement. I just wanted to make folks aware that with the regional abatement, OASAS is making payments on an annual basis. So based on the amount available in the state fiscal year appropriations, and the which is driven by the formula included in the settlement agreements, there are dollars that we make available. The regional share are dollars that were identified for a region, which we then allocate to the LGUs in each of the counties. As I mentioned earlier, there's also dollars that go to the 5 large cities and other litigating entities. So there are smaller towns, villages that also are identified in the settlement agreements, and there are dollars that are assigned to them that we make available. I know that screen looks pretty busy, but to make the point that here we have dollars that we're rolling out on a regular basis. What you see on the screen are actually dollars made available out of the 2025 appropriations, But for more information on regional abatement, you can go to the OASAS webpage and you'll see amounts made available for 23, 24, and we will continue updating and adding to the webpage as dollars are made available and as additional reporting is coming in. As I said, we will have information on each year's appropriations for regional abatement. As you can see, we have the amounts right now for 2023, 24, and 25. Again, by LGU, other litigating entities, those small towns and villages, and then also the 5 large cities. I think one thing that, you know, is worthy of note, and for people's awareness, often we talk about, you know, how much money is available, and there's discussion of, you know, how we're using these dollars over time. We do get an annual appropriation, and I believe we have about 15 years left, although additional settlements are coming in, so, you know, it may be longer than 15 years at this point, but point being that we are getting dollars every year, but for folks to be aware that the amount we get every year is based on the settlements, it's based on the agreements, and is not necessarily consistent. And as shown here on this table, there is a decrease. So there wasn't the settlements and the dollars made available there was kind of like front loaded. So we did see quite a bit of money in the first couple of years, but know that that amount as projected is less as we go forward. So just want folks to be aware, and certainly we have conversations with the LGUs and the other litigating entities about the need to plan and be thoughtful about the fact that you aren't going to get the same amount every year. That amount can change, so you need to plan accordingly. DOB does provide a projection of amounts available each year based on, you know, the most current information, what they know now. That information is available again through the Opioid Settlement Fund Advisory Board section of the OASAS webpage, so you can access those tables and that information. With regard to regional abatement, again, for awareness, we do meet monthly with LGUs and the other litigating entities in 5 cities. It's an opportunity for us to check in on things like the availability of funds, when we're going to be issuing award letters, when payments are going to be made, and also to talk about reporting. And as I said to folks just earlier today, reporting is something that's going to evolve in that the first year, we only were just making the dollars available through regional abatement, and so certainly couldn't start talking about spending, right? So as with our work, you know, there's an amount of time that needs to go into the planning and then like carrying out of RFA opportunities and then even contracting. And so with regional abatement, we're providing the dollar amount made available each year. In the coming year, next year, we'll start talking about what's in process. And eventually, we'll get to a point where we'll see spending and we can be talking about actual spending in the community. So we do work with the LGUs and the other entities, you know, around the reporting. Know that there is an enhanced report that you'll see coming out in 2025. Just as a reminder too, that's annual reporting that's done. We do have a process whereby we issue the report format, the report template in the spring, asking folks to report out on the previous calendar year's use of funds. I'd already mentioned the Opioid Settlement Fund Tracker. Again, another a really good resource. I had talked about the fact that we list by initiative, whether it be RFA or direct contracting, information about the project, and then the number of awards. So we do update the tracker as we make additional opportunities available. So please take time to check that out on the OASAS webpage. In terms of what's now, so what do we have currently underway? So we had talked about those 10 priority areas, and within those priority areas, we have the comprehensive low threshold buprenorphine project underway as one of our harm reduction efforts. We also continue to make harm reduction supplies available, and this includes both naloxone as well as test strip supplies. So both fentanyl and xylazine test strips are made available. We do have the OASAS portal for ordering and requesting naloxone. That portal supports the OMH and OASAS systems in accessing naloxone as well as individuals within the community. In the treatment area, we are working to integrate our outpatient system, and this involves our opioid treatment programs and our outpatient programs, wanting to ensure that individuals can walk through a door and have access to any of the 3 types of medication for opioid use disorder. So we're grateful to have the opioid settlement funds to help assist us in that effort. Continuum investments, we have the Addictions Professional Scholarship Program. We also have, I think there was a little more there, but the scholarship program is something that we're going to continue supporting with OSF. That's been a great opportunity to reach folks. And again, it's about workforce, providing folks the support to get the training and the education to come into our workforce. Under priority populations, we have a couple of projects doing outreach and engagement. As we have 2 models. We have the clinic model as well as the street model. And we also have our Connections to Care initiative. We are supporting transitional safety units as part of our housing work that we're doing. With recovery, we're supporting our recovery community and outreach centers. In prevention, we are supporting additional coalitions through the Community Prevention Coalition, Fentanyl, Opioid, and Prescription Project. We also have a non-medical transportation effort, and I realize I'm going quickly through these. And again, a shout out to the tracker. Any of these projects, all of these projects, you will find additional information going to the OASAS Opioid Settlement Fund tracker, and you can read about the project, looking at the request for applications, and then also see folks who have been awarded. We have ongoing awareness campaigns. Know that we had done some fentanyl awareness work this past year, and there is information about the campaigns and materials available on the OASAS webpage. And finally, with research, I had mentioned our government academic research and evaluation opportunities. So there is going to be more forthcoming with regard to the evaluation work we're doing on OSF and the work with our partner along those lines. So we have talked a lot over the last couple of years about making dollars available and the initiatives that we are implementing, identifying folks to do that work. And so just want to remind everybody that you know, that planning and identifying the use of funds, like what's our purpose and how are we making that available, is only the beginning of the work that we are doing. And so once we have actually identified an initiative, we've awarded providers, then the work begins. Then the service delivery begins. And a reminder, thinking in terms of sustainability, OASAS has intentionally awarded providers over a 3-year period so that they have opportunity to get service delivery up and running and actually have an impact. So know that the activities piece is what we have underway right now. As part of the activities, as part of the implementation, we do have regular meetings with providers who are doing the work, utilizing the OSF funds. We have mechanisms in place to monitor the service delivery, and to monitor requires data collection. And so in addition to working with and talking with our providers regularly, we also have data collection tools in place so that we can get information back on the services and the individuals being served. All of that to inform outcomes, right? What is the impact on the community in terms of the use of these dollars? And that's where that data collection is, comes into play in using that information. We do go through a process of cleaning and analyzing that data. Know also that part of the implementation and managing of this work means getting that data back to providers. So not only do we collect data to inform the evaluation, but know that the data collection also is a way of talking with the providers about the services they're delivering. It's a way of monitoring the service delivery to ensure that we're adhering to the model that was laid out in the RFA, that the services we intended to see delivered are being delivered. And then, of course, reporting out on impact. Once that OSF evaluation is underway, there is more that we'll be able to say over the years about the impact of the OSF dollars on the community. So in terms of what's next, as I mentioned, the Opioid Settlement Fund Advisory Board issues their recommendations on an annual basis. That report is due in November. So please be aware that you will see more information coming on that, and you will see that report posted to the OASAS webpage. If you're interested in looking at previous year's reports, again, available on the OASAS webpage. The continued implementation and evaluation, as I said, making the dollars available and issuing contracts is only the beginning. We are looking at service delivery over a number of years and wanting to also evaluate the impact of those services. And of course, continued collaboration. We meet regularly, as I mentioned, with the LGUs to talk about regional abatement. We meet with our providers regularly to talk about the service delivery and the program implementation. We also, as I mentioned, have our commissioner attend the OSFAB meetings, so also getting, coming together with the board on a number of occasions throughout the year, and just continuing to want to communicate, be transparent, make information available is our want in this process. So before we move to questions, Val, did you want to talk about the DOH work to date, and then we can move to questions and answers together?
Sure, that would be great. So hi everybody. I'm just going to give a few updates that have happened since the last time we did one of these community meetings. The solicitation of interest for the provision of harm reduction services via telemedicine has been awarded to the REACH project. The REACH project is a medical practice that provides support and care to marginalized populations with a special emphasis on people who use drugs. The organization engages individuals with respect and equitable access to compassionate care without judgment. They will provide telehealth care for medications for addiction treatment and opioid use disorder, and increase access to medical and social services to underserved populations in rural communities. The award amounts $500,000 annually for 2 years. And all of the information that I'm talking about can also be found on the tracker that Connie referenced in her presentation. We also set up a website for opioid settlement funding for the Department of Health on our website that Shay's going to put in the chat. It links directly to the one on the OASAS website, but if somebody came to the DOH website, we wanted to make sure people had access to find the information they were looking for. So it's now on both of our sites. So the New York State Department of Health Office of Drug User Health announced the availability of settlement funds to develop a formal standardized training program for coroners, medical examiners, and death investigators in New York State. The goal is to partner with eligible applicants across the state to help develop the curriculum based on national standards and best practices, and then subsequently deliver the training. The RFA is going to fund one agency for $200,000 annually for 2 years, and applications are accepted until 4 p.m. on October 3rd. And that is also, as I said on the tracker, but I'm going to also ask Shay if she'll just drop that link in the chat so that people have access to it today as well. Year 2 settlement funding contracts provides funding for contracts with 25 syringe exchange programs. These are currently being executed. 13 contracts were awarded for expanding harm reduction services for priority populations who use drugs. That was an RFA. All of these contracts are now executed, so services are being established. And we did use settlement funding. We are awarded settlement funding for naloxone as well. And at the state fair this year, Office of Drug User Health collaborated with 6 harm reduction organizations: ACR Health, Addiction Center of Broome County, Next Distro, Onondaga County Health Department, Reach Medical, and Trillium Health. We attended with them the fair for 8 out of the 13 days and provided 1,700 on-demand trainings on overdose awareness and response, and 2,125 naloxone kits were distributed. So it was nice. It was, we got a lot of feedback from people at the fair, and having staff available, even if they didn't need to be trained or didn't need naloxone at that point, we answered a lot of questions, really great conversations, and a lot of the people that attended the fair were really happy to have somebody at the table that they could just have conversations with as they were, right then and there. So those are the updates that I have, since the last meeting. And as Connie said, we're happy to answer questions, but thought I'd give a few high points. Thanks.
All right. So at this point, and I'm just getting eyes on the chat, know that folks are posting links to the information that I had referenced with regard to the tracker. Welcoming DOH putting up the link to the DOH tracker as well. And I'm going to jump into the questions that I see posted. Asking if there are any direct opportunities with the state for agencies that are in counties that received opioid settlement funding. And so I'm not sure if you're asking about opportunities for the use of the OASAS, the dollars that pass through OASAS onto the counties by way of regional abatement, or if you're asking about opportunities to apply for funding, OSF funding through OASAS. So I'm going to answer both. So I'm going to assume neither is which you were asking about, but know that all of the information on procurements that we make available can be found on the OASAS procurement webpage. In addition to posting on the webpage, we do send out an all provider send to notify folks or the target population, the target group for an RFA. We will send out email notification that the opportunity is posted and available. With regard to the use of dollars that go to the counties through regional abatement, we do provide on our OASAS page a link to each county's webpage, where you may find information on opportunities that are being made at the county level. And two, whichever county you're in, we always encourage folks to reach out to your local governmental unit and ask about the use of the OSF funding and possible opportunities. Oh, great. I see lots of links posted, so thank you to Celine and to Shema for posting those links. I don't see any other questions in the chat. So again, that's an opportunity to pose a question. I don't know, I will ask Kristen and Celine if any folks have their hands up, if there's anyone that wants to unmute and ask a question. So while they're checking on that, so thank you, Shema. So we do have the link for the RFA for the coroner training program is listed in the chat. The OASAS procurement webpage is also listed in the chat. And we have the DOH grant funding opportunities webpage. The link is available. All right. So as I understand it, there haven't been any hands raised, no questions from the community at this time. I want to give it just another minute. So if you're typing right now, you're typing out your question, or you're figuring out how to raise your hand, I want to give you a minute. As a reminder, we do host the community meeting on a quarterly basis. So be aware that you'll see us every 3 months. We'll be here to answer questions and also to provide updates. Information always available on the OASAS webpage, as well as the DOH webpage with regard to the use of the opioid settlement funds. So we invite you to bookmark those pages and frequent them. If there are no questions, I will thank everyone very much for joining this afternoon. Appreciate an opportunity to check in and to share information, talk about the work that we're doing, that OASAS is doing, that DOH is doing, that we're doing in partnership with OMH. And a reminder, next board meeting is on Tuesday of next week. Again, a link to that meeting is available on the OASAS webpage, and we invite you to view or go back and watch the recording, because we also post the recording. All right, everybody, have a great day. Thanks for joining.
Thank you. Bye-bye.